reasons why people are not getting the HPV vaccine and how we can best address that. And then I want to leave sufficient time in the end to talk about how we can use the current situation that we find ourselves in, meaning in the midst of this COVID-19 pandemic, where we're not going to be out of anytime soon, and seeing if there are ways that we can utilize what is happening with COVID and the COVID vaccine, and if we can sort of triangulate that and utilize that for other vaccines and specifically HPV vaccine uptake. So just a little bit of an overview, more for me than for you, because I think most of you are working more with the HPV on a daily basis. My work is primarily on vaccine hesitancy in general, and especially as it relates to online presence. But here are some of the figures in the age group 18 to 26. At least one dose of the vaccine in 2013, about 20%, in 2018, 29%. And we're seeing then a bit of a drop off in the full doses. Of course, one of the issues that we're seeing with, for example, the COVID vaccine is somewhat similar to the HPV vaccine, is that it's a multi-dose vaccine in a lot of cases for COVID and in all cases for HPV. And that's one of the practical things that doesn't have anything to do necessarily with hesitancy, but with the fact that it may be harder to get people to a doctor's office, to a provider a second time, as opposed to just coming in and getting one vaccine. Some of the studies have found that almost a quarter of US parents have a level of hesitancy towards the HPV vaccine. And that's higher than some of the other childhood vaccines. If parents express hesitancy towards a vaccine, that tends to be associated with lower uptake. That makes sense. And a lot of times it has to do with either safety concerns, with lack of necessity. Does my child really need this? And unfortunately, what we're seeing happen more and more is mistrust of physician info. And that has to do, I think, in large part with that. We're seeing an increase in mistrust of authorities, of scientists, of government officials, and unfortunately, occasionally also of medical professionals. This graphic on the right is from Johns Hopkins, and I think it's a nice comparison between issues that are mentioned by parents of girls versus parents of boys. I think that is one of the other things. The reasons of being hesitant for the vaccine are not always the same. And then it just in general, roots of vaccine hesitancy. This is not just for the HPV vaccine. This is for vaccines in general. Number one, vaccine hesitancy is not a yes/no proposition. It's not are you vaccine hesitant or not? Vaccine hesitancy, by the way, is defined as if you are able to get a vaccine, it's available to you, and you're choosing not to get it, or you're choosing to delay getting it. So it's available to you, and you're choosing, and it's recommended for you, and you're choosing not to get it, or for your child. Some of the roots of vaccine hesitancy are that we don't see the perceived threat of the illness that we're trying to prevent and the consequences we're trying to prevent. And I think that's a huge issue for almost all vaccines, except in some cases for COVID, because that's where COVID has been a little bit different, in that we've seen these consequences. We've seen ventilators, we've seen people in hospitals isolated, not being able to be with their loved ones. But in general, vaccines prevent diseases. And so we then see less of those diseases, and then the threat of those diseases becomes less serious in some of our eyes, and that can be actually a root of vaccine hesitancy. There is also an increased concern for adverse effects, and both those have to do, not entirely, but at least in part, with an emergence of the internet, social media. That is not the only place where vaccine hesitancy pops up, but it is one of the places that it tends to spread. And the other thing is, before we talk about actually marketing the vaccine, we have to realize who is our audience, right? That's the first thing you want to look at. If I'm trying to market something, what is that audience like? And what are the areas that they might be concerned about? And if vaccine hesitancy can be a real issue in that. And then, like I just mentioned, there is a real issue with a diminished trust in authorities. I think if you have been on social media platforms, you probably have seen the term, "I can do my own research." To which I tend to respond under my breath every time I see that, well, yes, you can, but it won't necessarily be very high quality research, because you don't have the background a lot of times. And that's the same thing for me. If I need information about what components are in a vaccine, that's something I go to specialists for who have developed the vaccines. That's not something that I go to Wikipedia for. But I think the most important thing to realize is that there is that continuum of vaccine acceptance and vaccine refusal. There are some people who say, I will not get any vaccines. My children will not get any vaccines. And there are some people who say, I will get any vaccines the CDC and my local Department of Health recommends, and my pediatrician, my family physician recommends. A lot of people are somewhat in the middle. They may accept the vaccines, but they're not 100% sure. They have some questions about it. They may delay or refuse some, or they may refuse the vaccine, but we may be able to convince them and say, you know what are your questions? What are your main concerns? So when we're talking about marketing vaccines, we're bringing together medical practice with the practice of marketing. And fortunately, people have done amazing job at developing a theoretical model called social marketing. And basically, social marketing, what it does is it uses commercial marketing techniques to analyze, to plan, to evaluate programs designed to influence voluntary behavior to either improve social or societal welfare. So you're using techniques that are used in marketing, but you're using them for the good of people's personal welfare or society's welfare. Not all marketing techniques apply, but some of them are very applicable. And I think some of the main things behind social marketing, behind influencing people and behind communicating with people to the value of getting these vaccines, and specifically the HPV vaccine, I think the first thing to realize is that this has to be something that's approached from different angles. Physician recommendation is incredibly important. Physician or any other provider recommendation. But also, people need to see a presence in what they see, what they encounter when they go online. Social marketing specifically focuses on health and preventative behaviors. That's where it's particularly helpful. So when you're dealing with preventative behaviors, which of course vaccines are a prime preventative behavior, social marketing tends to be something that is useful and that works well. In part, social marketing is built on two health behavior theories called the health belief model and the theory of planned behavior, and on the concept of persuasion. I'm going to go into those theories a little bit, because that, I think, those gave us the most tools as far as if I'm actually trying to market the vaccine to either patients individually or to larger practice or larger society. These theories tell us how people are most likely to accept certain messages. And when we're looking at persuasion, what we need a message that's effective. We need a messenger that's trusted, and we need an audience that's willing to listen. And so it's not just about having the right message. People have to trust the messenger that the message is coming from. Fortunately, as healthcare providers, we are still among the more trusted messengers. Public health entities sometimes are not as trusted at this point. For example, there are people who, and I adore the CDC, I think they do amazing work. There are quite a few people out there who won't trust the CDC for all kinds of reasons. So CDC can provide great messaging, but if people don't trust the CDC, then that messaging has to come from someone else. And so I think that is where, as healthcare providers, being invested in people's lives and patients' lives, there is a much more direct connection for that effective message to get through by the trusted messenger. One of the main things I think is that there's no one size fits all for this. I wish there was. That would make it easier. But I want to run one initial model by it. It's called the social ecological model. And basically it says that when we try to make decisions as individuals to get a vaccine, say the HPV vaccine for our kids, that our decisions are influenced by multiple dimensions, and particularly by 4 different dimensions if you follow the social ecological model. It's the individual sphere. So this is anything, what is your patient's age, their education, their income, their socioeconomic status, their existing beliefs about vaccines, their existing beliefs about medical care, their health history, their family's health history. Then interpersonal are the relationships. So family, peers, partners, social networks. If a patient is part of a social network that is comprised of groups that are convinced that vaccines cause autism and that vaccines are harmful and vaccines were created to not help but hurt, that is an interpersonal relationship, and that can be incredibly powerful because these are people that they encounter sometimes every single day. And so that can really affect whether someone says, I will get the HPV vaccine for my child or for me personally or not. Then community is anything related to neighborhoods, to schools, to workplace, to religious organizations. So one of the things we're seeing come up over and over again with vaccines is in religious organization context that people are concerned that vaccines were developed using fetal tissue cells. We're seeing that now happening with the COVID-19 vaccine, where several bishops, Catholic bishops here in the US, have made a statement and said, we're recommending not getting this vaccine because of this issue. And that can have an incredible impact. And that's an impact on a community level. And then societal has to do with social and cultural norms, but also, and maybe even more so, with policy. And so if there are laws, bills that are being introduced, or laws, and so all of these different things can have an impact. Here's the thing, we can usually impact all these 4 spheres. The societal sphere may seem like it's harder to impact, but this is one of the reasons why I believe that we as researchers, as medical providers, as public health professionals, we should be involved in policy, in recommending policy and advising policymakers and in clarifying issues especially when issues are tend to be controversial. Community, I think that again, that is being able to reach out through community organizations. And again, I think we're seeing through COVID and through the COVID vaccine some models that we may be able to use for other vaccines, including the HPV vaccine. For example, there are more religious organizations and churches right now that are making announcements about getting the COVID vaccine. Well, if they're willing to do that, can we ask them to make an announcement about the importance of getting the HPV vaccine for your children? I'm not sure if that's been happening a lot, but if it hasn't, that is something where I think we're getting more used to that concept. Vaccines right now, if COVID has done one thing that is good, I think, is it's gotten vaccines back into the forefront of people's minds. Not everyone's going to get the COVID vaccine. There are real issues with hesitancy, but conversations right now with all my friends and family are, have you gotten the vaccine? If so, which one? Did you get side effects? And when are you going to be fully vaccinated? Now, I tend to travel in some medical circles, but it's the same thing with my friends and with my sisters in the Netherlands, with my mom. And I think that that is something, I don't know the solution, but I think that is something we need to keep in mind, that we may be able to build off of that we have an opportunity right now, that we're living in a different world than if we were doing this webinar or this online meeting 2 years ago. So keep in mind that with the social ecological model, that all these 4 areas can influence people's decisions on whether to get vaccines or not. So are they in a situation where where family members are opposed to getting vaccines? Are they coming from an individual background where they may be less likely to accept vaccines? Because if we know where someone's resistance to a vaccine comes from, it's easier to address it. At the same time, if we know where someone's acceptance of a vaccine comes from, it also makes it easier to communicate and say, here's why you should do this. Here's what makes an impact. Right. So keep those 4 things in mind. And even though we tend to be individuals, we are operating in all these 4 circles, and we have all these opportunities to have an effect. So I mentioned that social marketing is built on 2 other main theories. One is the health belief model. The health belief model was actually developed primarily initially for use with vaccines. So it's a perfect theory for communicating about the vaccine. So if you're trying to communicate about, say, getting the HPV vaccine, there's 6 things that make it easier for people to say yes to the vaccine. Number 1, they need to be convinced of the severity of the health issue. So they need to be convinced of the fact that infection with HPV has consequences that can be very serious. And this is where our conversation about this is connected to several forms of cancer that may not show itself until years down the road, but people need to be convinced that this is actually, if I'm going to get a vaccine to protect me, what is it going to protect me from? Is it worth getting this vaccine? Will it protect me against something that is serious? So they need to be convinced of the perceived severity. Number 2, they need to be convinced of their own susceptibility or their child's susceptibility. And this is where questions come in. Well, but my child is not sexually active. Well, that's the reason why we want to give this vaccine before they become sexually active. At some point, they will become sexually active. And convincing parents of the susceptibility of their child, or their own susceptibility, if it's about their own vaccines, that is really important, because I can be convinced that HPV causes things that are serious, but if I think I'm not at risk, I'm still not going to get the vaccine. They need to be convinced of the benefits of the recommended action, so the benefits of the vaccine. I can be convinced that the consequences of HPV can be very serious, that my child can be at increased risk for these. But if I don't believe that the vaccine actually works, that if the vaccine is given, that it will protect my child or myself from the consequences of this virus and of this infection, still, I'm not going to get the vaccine. There need to be a low level of barriers to the recommended action. So a low level of barriers to the vaccine, to getting the vaccine. And that can be anything from, I don't know where to get it, I'm concerned it's going to be expensive, to, I don't believe the vaccine works. I believe the vaccine is causing harm. I'm concerned about adverse effects. I'm concerned my child is going to get sick and there's nothing else I can do about it. So those barriers have to be low. Benefits have to be high, perceived benefits, barriers have to be low. And then self-efficacy, people have to be convinced that they can actually get the vaccine. For the HPV vaccine, we usually make this fairly easy. There's a good system in place. For the COVID vaccine, for example, that hasn't been perfect, let's put it that way, because for a while, people who wanted to get the vaccine weren't necessarily able to just go somewhere and get it. You had to wait until your number sort of came up. That is all changing right now, and it's changing very quickly. But self-efficacy can play a really important role. And then cues to action. As human beings, we need to be prompted. And a prompt can be as simple as a healthcare provider saying, it's time for your daughter or your son to be to receive the HPV vaccine. Let's do that today. That's a cue to action. But a cue to action too can be a social media message that they see. It can be a message that says, make sure your child gets the HPV vaccine, or it can be, make sure your child doesn't get the HPV vaccine. It's dangerous. So the health belief model works if these 6 things are in place. And so if you're communicating with patients or potential patients or with family members, this really goes for everybody, then you want to make sure you're not just talking about the vaccine works so well. You want to make sure that people are also convinced that actually disease you're preventing them from getting is something that is serious, that they are at risk. And you want to find out where the barriers might be. And that is where the whole vaccine hesitancy, potential misinformation comes in. So that's the health belief model. And a lot of times what people do is they use parts of these messaging, but they don't use all the constructs together. And the way the health belief model is set up is that you really need all of these components and they work in concert, they're more likely to work as messaging strategy. The second theory is called the theory of planned behavior by Eisen. And it basically says the best predictor of whether someone's going to take a specific action is whether they intend to do it. So if you can get someone to say, yes, I am going to schedule my daughter to get the HPV vaccine, or my son, or myself, that is one of the better predictors on whether they're actually going to go ahead and get the vaccine. That intention is then predicted by behavioral beliefs and attitude towards the behavior. And that is sort of like severity and susceptibility. These models overlay. So what are people's beliefs about the vaccine? Do they believe it works? Do they believe that the infection is serious? Perceived behavioral control is basically self-efficacy by another name. But then the third variable is subjective norm and normative beliefs. And that's different in the theory of planned behavior. Basically, what that means is that people will be more likely to take a certain action if people that are important to them encourage them or get the vaccine as well. It's a form of peer pressure almost. And it can work both ways. So if my family supports me getting the HPV vaccine, I am more likely to get it, unless the relationship with my family is not good. Then the subjective norm works the other way. And if my family can be very supportive, but if I don't trust my family's opinions on this, it can actually boomerang back. But that idea of influence from those that are around you and are around your patient, that is subjective norm and normative beliefs. So I wanted to bring one thing up, and that is, I mentioned in the early part of this presentation that one of the things that is really something that we're having to deal with is this concept of vaccine hesitancy and misinformation spreading through online messaging and online activity. And one of the things that we have seen is that social media platforms have taken significant actions over the past few years. As an example, Pinterest in early 2019 decided to take action against anti-vaccine posts. And basically what they did is they said, you can search for keyword vaccine, but we're not going to give you any results. We'll block those searches and we'll say, there's a lot of misinformation on our platform related to this topic. We recommend you go to the Department of Health and Human Services. Here's their link. Internationally, they would refer them to the World Health Organization or something similar. And then in the late summer of 2019, they followed this up and said, okay, instead of just blocking these searches, we're now going to actually populate these searches and curate them. And we're going to give you messages by public health organizations, by the CDC, the World Health Organization, different departments of health, different hospitals that have good messaging systems. Pinterest is not the only one. Facebook, Twitter, Instagram, platforms all have been taking action to address misinformation specifically about vaccines really since 2019 have they become a lot more active. What I wanted to briefly mention is we did a study to see if that actually worked. And we took 2 samples of Pinterest messages about the HPV vaccine. We used keywords vaccine and vaccination and HPV associated with that. And we used the health belief model, seeing if any of those constructs were present. And then what we found is that we looked at the pre-action posts and the post-action posts. Well, pre-action, mostly individuals were posting. There were no public health entities posts that showed up. There were very few health care providers or health organizations that showed up. And so it was primarily individuals. That's not necessarily a bad thing, but it can be something of concern, and it means that trustworthy entities that may have the information that we want people to get just weren't showing up in the searches as much. Well, what happened post-action is good. Now a quarter of the posts only were posted by individuals. Almost 50% came from some form of official medical source. And almost 10% came from like the CDC or the Department of Health and Human Services. We looked at the health belief model. 2/3 of all the posts in the pre-action period actually mentioned barriers to the HPV vaccine, perceived adverse reactions up till and including death. 15% conspiracy theories. The HPV vaccine was created to do damage, to actually hurt your children and not help them, to be involved in population control. And while that 15% doesn't sound like it's that high, when you realize what those messages are, is they shouldn't be out there. That's a real concern. And less than 15% each talked about the benefits of the vaccine and cues to action to get the vaccine. Severity and susceptibility of HPV and its consequences were basically not present at all. So post-action, Pinterest takes action, now curates these messages. Great. 40% of the messages actually talk about the HPV vaccine. 20% each severity and susceptibility. That's a real improvement. And only 10% brought up barriers to the vaccine from a perspective of you shouldn't get the vaccine. Now, it's still concerning. There were still 10% of those, but it was an incredible reduction. We looked at engagement, and we could only look at that pre-action because post-action Pinterest does no longer make this available. But pre-action, we found that Pinterest posts associated with increased engagement were all anti-HPV vaccine, saying the HPV vaccine is a threat, that it will kill your children, that it will provide serious adverse reactions. It may paralyze your daughter. It may make your daughter not be able to go to school. That HPV itself is not serious. Here's your perceived severity. And a lot of times they use stories, narratives, photos, names of those perceived adverse effects. And regardless, those stories are heartbreaking. Regardless if we know if they're true or not, and if there's even a nugget, a kernel of something in there, there are stories there that are heartbreaking. They're just not presented with context. And then we saw a lot of fear visuals. And fear visuals are anything that have messages that are created with excessive imaging that elicits fear. So huge needles, out of proportion reactions on faces. But here's the issue. You see a picture on your right that I got off of an actual public health messaging board yesterday. And they did not intend for this to be a fear visual. And for most of us, maybe it's not a fear visual, but if you have any patients that deal with any level of needle phobia or fear of needles, seeing that syringe and that needle right in front of that picture, and it's the emphasis, the focus is both on the vial as well as on the syringe, can actually function as a fear visual. So keep that in mind. It's something that we're learning more and more about, that things can function and can actually keep people from getting vaccines. So what we found, though, is that all these pins that were associated with increased engagement, they were just all about anti-vaccine and anti-HPV vaccine. We couldn't measure it afterwards. But here's the thing. This all sounds like it was that these actions from social media platforms did a great job. And I want to just provide a word of caution for that, because here's some of the other things we found. All the pre-action pins talked about the HPV vaccine or HPV. Post-action, only 40% of posts did. What did the other posts talk about? Other vaccines, vaccines in general, and almost 12% did not mention vaccines at all. Talks about cleaning supplies, kids' activities, but not information that we're trying to get to people. And the other thing we found is that a lot of the visuals were really subpar. For example, Pinterest would choose somehow images of flyers, scanned flyers with lots of text and a few small visuals on it. The information can be great. That's not what you need on social media. That's not what's going to get people's attention. What we think happened is this, and this is not the case with every platform, but I want to use as an example that when we hear about social media platforms taking action, let's not get too excited too quickly that misinformation is disappearing and that everything works well. Hang on, that wasn't supposed to go yet. We searched for vaccine and we found some of these results. And then we searched for HPV vaccine and we got the same results: hepatitis B, rubella, flu, mumps. I'm not even seeing HPV on here right now. We searched for flu vaccine, same results. So what we think is happening, and this is still the case, at least it was last week, is that what Pinterest did is they said, you know what, whenever someone searches for vaccine, no matter what vaccine it is, we're going to give them one set of search results and not a specific set per vaccine. You all know very well that the HPV vaccine, in the way it works, in the communication about it, is not the same as the flu vaccine or the tetanus vaccine or the MMR vaccine. And so this is a real concern. I think it's at the basis of what's not working about this. The reason why I'm mentioning this is saying, yes, what social media platforms are doing works, but some of it didn't. It may cause other types of misinformation. It may cause an information vacuum. And I think we need to not lose track that patients, friends, future patients, connections may still be encountering misinformation on social media related to the HPV vaccine, even though it sounds like we've made great strides. So a few conclusions. Marketing and communicating about the HPV vaccine should be a multidimensional approach. It should be about communicating as healthcare providers. Fortunately, healthcare providers are still high on the list of trusted messengers. But also should be aware of what people may encounter when they're not interacting with us, what people may be encountering when they're online. And let's face one thing, over the past year, a lot of us have been spending a lot more time at home, whether we call it lockdown or quarantine or work at home. For a lot of us, the good internet lives there as well. And that means that people are more likely to search for things and encounter things about any kind of medical issue, including the HPV vaccine, be aware of some of the things they may encounter. If you are planning your communication about communicating about the HPV vaccine, use a theoretical approach in the sense of take the health belief model and make sure you're not just communicating about how good the vaccine is, but also how harmful it is if your child is infected with HPV, what the possible consequences are, etc. So take that and sort of make that something that is part of your messaging and go down the list of, am I addressing these things, all these things. I know that within the healthcare and public health field, many of us are hesitant to be very active on social media. And I understand a lot of the reasons. And I absolutely don't recommend that people do things that they're not comfortable with, but we need to see more good messaging. The messaging that's out there can be excellent, but if there is an overwhelming higher quantity of misinformation about the HPV vaccine online, then no one is going to encounter the great messages that we have out there. So if nothing else, consider forwarding messaging from the CDC, from VDH, from the World Health Organization. You don't take a risk that way when you just spread information about trusted agencies and you don't have to spend the time on it. So I would encourage you to at least think about that. And then finally, when we start talking about, when we have a little time of question and answer, and my slides are not working. There we go. Here we go. I wanted to mention the COVID factor again. I think we have seen, and you see a picture here of someone who is excited. You know, you see she's wearing a mask. You can see her eyes are smiling. She's giving a thumbs up. Yes, we're seeing hesitancy related to the COVID vaccine, but I have never seen excitement about a vaccine in this way. You know, people are excited about it. I'm getting the second dose of Moderna this afternoon. I'm excited about getting the vaccine. I'm excited about, I had some side effects the first round. I'm counting on having some next tomorrow and, you know, try to keep most of my schedule a little more open. I'm excited about getting this because of what this vaccine means. We haven't seen this, I think, in a long time. I think in our generations, we haven't seen it. I think the last time we looked at this was polio and smallpox when we saw those vaccines come forward. The COVID vaccine is seen as crucial to get back to quote unquote normal. And I think one of the things I want to challenge us with, and I don't have the solutions for this, but how can we learn from what we're seeing with the COVID vaccine, not just from the hesitancy around the vaccine, but what about the people that are excited, people that drive 45 minutes, an hour and a half, 2 hours to get a vaccine, people that stand in line? Can we somehow take what we're learning from the COVID vaccine and apply that to other vaccines, to communicating about other vaccines, to make people realize, hey, you know, you've gotten the COVID vaccine, so wonderful. This is actually protecting you and your family. Let me talk to you about other vaccines. How can we utilize that best? And again, I don't know what the solutions are on this point, but I do know that I think we may have an opportunity. And I think Jeanine and Juanita and a few others and I had this conversation about a year ago. I think we talked about this and we said, this could be a real opportunity. And then we went into a year of not a lot of information about the vaccines, a lot of misinformation. And I think a lot of our focus has been on the COVID-19 vaccine and misinformation and hesitancy. But I think let's also look at the excitement about the vaccine. We were talking in the beginning of, right before we were starting our presentation, before we started Zoom, about the conversations that we're having right now. I think 90% of my conversations with people I haven't seen in a few weeks or haven't talked to in a few weeks are, have you gotten a vaccine? Which one did you get? How are you feeling? What are your plans once you get fully vaccinated? Like, it's taken up a real presence in our lives. Can we utilize that somehow to translate this into getting more people HPV vaccine and other vaccines. So that is my question I want to leave us with, and I hope we can. I think there's opportunities there. I don't know exactly what they look like, but I want to keep that as a challenge for us. And with that, I am going to stop sharing my screen. Any thoughts? Ooh, I like this. In the chats, promoting HPV vaccination during the COVID-19 pandemic. So please, I am clicking on this link right now, and I'm keeping that. So make sure that if you haven't yet, that you keep that.
And I tried to bring back up the, I'm hoping I was bringing back up the post checks, but I think Dr. Guidry, you make a great point, and we talked about the need or the necessity, like all the boots on the ground right now, and using the momentum that we've created around COVID-19. How can we turn that, use, sorry, my coworker's going crazy in the background. How can we use those folks on the ground, all these people that are deployed to help with that conversation in some other cancer awareness, getting screened and getting HPV vaccination. So I think you make a great point. It's, people are really engaged and excited, and how can we continue that momentum for other very important conversations?
And I think one thing with that too to keep in mind is, I think that if there is such a thing as kind of a magical moment right now, that's not going to last forever. Like, we're going to move out of that. We're going to go back to a more normal life. It may take us longer than what we think, but yeah, I think we should think about this and should realize that we have a window and we don't know when that window is going to close.
I do want to ask, I've seen a lot of, like, especially on Instagram, for example, various people use different, I guess, there are different designs to disseminate information. So you'll see like how to be anti-racist, and there'll be a couple of slides to go through. And I've seen a few done by health organizations, but do you think that we could do a better job of creating those type of things where people can quickly access a lot of information? I think I saw one recently from Johns Hopkins giving the different, what the differences are between each vaccine, which I thought was amazing. But do you think more content should be made so that it could be shared on things like Pinterest and things like that?
Yes and no. So yes, because yes, we need more and better content. But I think the thing that we need content that is tailored towards the questions that people have. I think a lot of times in public health communication, we have, and I'm talking to myself here, I have a tendency to provide big infographics with all the information and the kitchen sink in it. And number one, that's an issue when people are dealing with health literacy. Number two, those may not be the questions people have. So I think having better information, but having it in bite-sized pieces so that it can be applied. If someone has a question about why does my child need the HPV vaccine, they're not sexually active, answer that question and have that in a good message. What about, I've heard things about side effects of the HPV vaccine, having that in a message. So having, and I think that's another thing is, if someone is hesitant about any type of vaccine, find out why they're hesitant. I think for a lot of times for the COVID vaccine, what we're seeing, for example, is that people are saying, well, it was developed so quickly. I mean, come on, public health people, you tell us that vaccines take 5 to 10 years to develop, and now you're giving us 3 in a year? What's going on? You can't, I'm not blaming people for asking those questions, but those are easier to answer. Like, there are ways to answer that and to say, you know what, here's why the corners were not cut. That's a very different question from, I think the vaccine has a chip in it that was put there by Bill Gates. And there are too many people who believe that. So yes, I think we absolutely need that. I think the volume, because there's so much information online, is we need to see more volume come out of that for the correct information. Because the other thing that we know is that once people have a question about something and once they hear something and they accept it, that's pretty much game over. It is really hard for human beings to change our minds once we've become convinced of something. And that's not just with vaccines, that's with anything. That's just who we are. That's how we're wired. I saw a question that's interesting from Kathleen, that the majority of theory-driven public health and social media campaigns are more cognitively oriented than effectively oriented. Affectively, I'm sorry, English second language, Kathleen, my apologies. And the misinformation is the opposite. That's a really good point. Misinformation, campaigns that spread misinformation about vaccines tend to be focused on narratives, tend to be focused on, I know someone, a sister's, brother's, neighbor's family member, and they got the vaccine and they died. And then there's a picture with it. And we've seen that with the HPV vaccine. We're seeing it with the COVID vaccine. We can come in after that and say the CDC went in and they confirmed absolutely that there was no connection. Correlation does not equal causation. It's really hard to come up against that. And the thing that is hard, it's hard for us to provide these narrative campaigns, because if a vaccine works, something doesn't happen. You don't get sick. It's a story about something that's not present, and that's a hard thing to communicate. Where I do think that we need to get better at telling the stories of the lives that are lived and the lives that are saved by these vaccines. My dad died of cancer about 13 years ago, colon cancer. If there had been a vaccine against colon cancer, my family's in the Netherlands, I would have swam across the ocean to get it for him. I mean, I would have done anything. This idea of, but I think one of the keys that we see is in the COVID vaccine, the picture that I showed on the screen of the woman getting the COVID vaccine and the smile on her face. I think that might be a key of a more effective campaign of showing happiness, of this makes it possible for us to spend. What do vaccines do? They make it possible for us right now to hug our grandparents again. Well, what about the HPV vaccine? It makes life healthy for our children. It makes our children be able to have a future that is healthier, and that they have more time living their lives. It's a hard one. This is a hard one, and we need to get better at it, because I think a lot of times I tend to think as a messenger, well, if I just give them all the facts, it's going to work. No, that it doesn't. And especially doesn't if you have emotional stories on one end. And on the other hand, let me give you the 3 best points about the HPV vaccine or the COVID vaccine. So yeah, we need the information, but we also need better stories. And I think that is where we need to work with marketing professionals. I think we need to work with advertising professionals. What are better ways to tell those stories? And are there better ways to use visuals with that to really tell a story that is going to be sort of at the level of the other stories? And the reason why misinformation messaging works is it deals with fear. It also deals with the fact that if you give a vaccine, you put something in your body that you're voluntarily doing. And you don't really have to do it. It's not a medication that's treating something at that point. You're doing it to prevent something. Again, these are things that are harder to help people make sense of, but we have to try to do a better job at it.
Thank you so much, Dr. Guidry. We really appreciate your participation. Oh, I just see that come through the chat. Can you see that, Dr. Guidry?
Yes, absolutely. I completely agree. I think that you're right. Humans tend to believe a lie easier than the truth, but we shouldn't give up. I really do think that we have incredible opportunities, and that every life we touch, every vaccine that we give, that we see given, potentially save someone's life. And I think that is just to keep in mind and say vaccines are a tremendous, amazing public health triumph. And let's keep in mind that it's not just at the percentages of the population, it's also at the individual lives. Every vaccine we give is going to allow someone to hopefully have a better life and a healthier life.
Thank you so much, Dr. Guidry. You really are dropping gems, and we are recording this. So if you'd like to revisit her presentation and learn more about her, please also, you see her contact information there on the slide. We have a exit survey just to see how your experience was. So please feel free. We know that the date says 2020, so please just ignore that and choose the corresponding month. This month is April already. So we love your feedback. That concludes our presentation for today. Thank you so much, Dr. Guidry. That was amazing. Our next peer-to-peer event will be on, what is this? We can go past that knowledge check just for time's sake. Our next peer-to-peer will be May 5th at noon. If you haven't registered, we will make sure that goes out. We will also be sending out a follow-up email. Should you have any questions, please respond to that email. Thank you guys so much for your time and for joining us.
Bye. Thank you.